Are you thinking about getting some B12 shots and wondering how many B12 shots do I need? What are the things that tell me I need more? What are the things that tell me I need less? Do I even need a shot? How do I make this decision and how do I understand my need for B12? My name is Dr. Taranella. In this video, we're going to look at that specific question: how many B12 shots do I need for different circumstances? We'll take you through sort of a spectrum of different need for B12 shots so you can better understand what you might need in terms of B12 shots. So again, my name is Dr. Taranella, and if you're new to this channel, I just want you to know that I make these videos to help you go beyond the basics of your health, whether it's a confusing lab test, symptom, or diagnosis. I make these videos to help you get a better understanding of what's going on with your health and what sort of things you should be thinking about. So if you like this kind of information on nutrition, hormones, health optimization, etc., click on the like button and don't forget to subscribe to the channel to get more videos like this one. Now for a quick disclaimer, the information contained in this video is for informational purposes only. It's not intended as treatment for any medical condition or a substitute for seeing an actual doctor or medical professional. It should be used as an educational guide to deepen your understanding of your own health and treatment success. If medical attention is needed, don't delay in seeking that attention. All right, let's look at this question. How many B12 shots do I need? So I wanted to give some general thoughts and ideas on this question of how many B12 shots do you need, should you take, what is necessary, and what is too much. So I think the first thing you want to think about is how you're coming to the understanding that you need to take B12. Is it based on a sign, like an objective measurement, such as high MCV, high homocysteine, high methylmalonic acid, or is it a result of some kind of symptom, like some sort of neuropathy, nerve symptom? Maybe it's more fatigue, malaise kind of symptoms, or maybe there's just a general sense that you think you need more, or maybe it's based on a genetic test. There's a whole host of reasons why people decide they need to take B12. And so in terms of how many shots do you need, it's really going to depend on the mix of these different things related to signs and symptoms. So we can put this on a spectrum of someone that needs more versus someone that needs a lot less. On the person that needs a lot more, well, they're not going to be consuming a whole lot in one scenario, and they're also going to have more extreme manifestations of B12 deficiency. There's probably going to be some signs there too that are present showing that there is indeed a deficiency going on, such as a serum B12 test that is abnormally low, below the reference range, maybe a high homocysteine or high MCV. On the other end of the range, you may have actually a fairly normal B12 level where it's actually within the normal range, but it's just slightly low on the lower end of normal. But maybe you do have some manifestations where you think you might be having a problem from B12 deficiency. You certainly can try a few shots and see if it helps. That would be reasonable to do. You could, of course, just take it by mouth and see if it helps out with. So, of course, the biggest thing is like, what about everybody in between? How many shots are you going to need? Well, if you have a problem like pernicious anemia, where you're actually not absorbing the B12 from the food that you eat, you're going to need ongoing shots, usually once a month in the beginning, depending on how low the levels are and whether or not there's manifestations. You may be doing weekly shots, maybe even 2, 3, 4 times a week, B12 somewhere in the 500 to 1,000 micrograms per dose. Then there's the person that maybe just following a vegetarian or vegan diet. They got deficient for a while. Once they figured it out, now you're going to correct it. You may do a series of shots, maybe once a week or every other week for 4 or 5 shots, and then you back off, see if you can maintain those levels through dietary means or supplementation. Similar vein would be someone that really isn't vegetarian or vegan. They're just low and there's really no reason for that. It could be a digestive issue. Maybe they do have an absorption issue but hasn't been identified yet. You may take a series of 4 shots, 5 shots, and see if you're able to maintain that through dietary means or oral supplementation or addressing the reason why you're deficient to begin with. So there's a complex array of different things that are going to be at play here when deciding how many B12 shots do I need to take or do I need for my specific situation. But these are some of the things to think about when you're trying to answer that question. So if you found you have a B12 deficiency, it doesn't necessarily mean you need to take a shot. Sometimes these can be corrected through oral means where you swallow it, or a sublingual version where it dissolves under your tongue. If you're not really getting much out of your food, taking it by mouth and swallowing it is probably going to do the same thing. Maybe you get a little bit more, but it's really probably not going to help that much. Sublingual versions of B12 are going to be the best bet in the case that you're not absorbing it from your food. You're already consuming B12 in your food and it's just not getting in your blood. You're still low. So these are some of the basic things to think about when you're asking the question, how many B12 shots do I need? Or when you're asking the question, how many B12 shots do I take? How many B12 shots do I need to correct the deficiency, etc. Of course, I think it's important to note because there is nuance with all this stuff and it's hard to get the context of each individual person out there. You need to talk to your doctor when you're considering taking B12 shots because they are the ones that are going to be able to fine tune that for you, help you think about this in much more nuanced, detailed way that's going to give you the best outcomes. So how'd I do? Does that help you better understand this question? How many B12 shots do I need or should I take? Hopefully it does. If you have additional questions on this topic, drop it in the comment section and I'm happy to answer your question. Thanks again for watching. We'll see you next time.